So let's talk about one of the best remedies for cardiac arrhythmias. Now, whether we're talking about minor palpitations or atrial fibrillation, one of the big problems with a severe arrhythmia issue is that the blood can pool in different parts of the heart and create clotting, and then that can actually turn into a stroke. When you go to the doctor, they'll treat it with either a beta blocker, a calcium channel blocker, or digitalis. What I want to do in this video is give you an alternative, but of course check with your doctor before discontinuing any of this medication. That being said, the unifying theory or agreement that most of the medical professionals have about an arrhythmia is that there's a problem with calcium. Calcium is leaking from the cardiac cells. Calcium is very, very necessary in the body, but if there's too much in the cells, that can be very toxic. And if there's too much outside the cell, that can be very toxic as well. Now, there's many different purposes of calcium in the body, but one huge function of calcium is it's a signaling molecule or a messenger type molecule that causes certain functions to occur in certain pathways. Calcium also affects another signaling molecule, which is right here. I don't want to get into the details. It's CAMP. The only thing I want you to know about this right now is it's another signaling molecule, and it works with calcium. When you have arrhythmias, there's going to be a problem with this and a problem with this. Thus, the medication, a calcium channel blocker. And another medication used for arrhythmias called digitalis, which affects the sodium-calcium relationship. In past videos, I talked about potassium deficiencies and magnesium deficiencies causing arrhythmias. And the reason why these two would work is because both of these minerals help balance calcium and keep calcium from becoming too toxic inside the cell. And if you have an advanced arrhythmia, you could be pretty deficient in magnesium and potassium, and that could take some time to fortify your body. It could take actually even months. But in the meantime, there's a really good remedy that I'm going to recommend, d-ribose. And D is actually the natural form of ribose. And ribose is a signaling molecule for this other signaling molecule. Okay, it's kind of like a precursor or a building block for this right here, because it improves cardiac muscle physiology. It's also recommended when you have cramps or soreness in the muscle after you exercise. So it tends to bypass the damaged pathways in the heart, and it gets the myocardial cells, the heart muscles, to work better. It also can reduce angina. It's also good for reducing fibromyalgia, chronic fatigue syndrome. And the dosage I'm going to recommend would be 5 grams 2 to 3 times a day. You don't want to go over 5 grams because sometimes it can actually give you a little digestive problem. Maybe it's too much gas or even diarrhea. So stick with 5 grams 2 to 3 times a day, and you'll notice that this will give you a lot of relief. Some people mix this with their coffee because caffeine aggravates arrhythmias, but adding this to it will tend to rid the jittery feelings or the abnormal extra palpitations you may get when you consume caffeine. And I also want to add this, you probably already know this, but drinking alcohol causes arrhythmias, chronic stress can cause arrhythmias. Of course, eating food that depletes you of potassium, magnesium will cause arrhythmias. A lot of refined carbs and sugars and refined grains, and also a diet low in potassium, magnesium. And that would be a diet that's low in vegetables. An average American consumes only 1.5 cups of vegetables. So I don't know where they're getting their minerals from, but over time that can lead to problems with the heart. Also, exposure to EMF. I've done a video on this in the past, and this is a big problem, especially if you're sitting in front of your computer all day long. What's going to happen is the electromagnetic fields from those electrical devices can interfere with your own electrical fields and create arrhythmias just right here. So you may want to get that checked. Definitely work on these things, okay, to actually get to the bottom of the arrhythmias. And you may want to start taking this remedy to give you some relief in the meantime. I personally don't sell this product. I don't recommend a brand. you're going to have to do your research on that part. Thanks for watching, and I will see you in the next video.
Hey, we're back.
With another amazing recipe.
No grains, no sugar, totally keto. There's no suffering in keto.
Absolutely not, Karen.
And it's an immune system builder.
Absolutely. You have to check this out.
I think you should hurry up, watch the recipe, and make it yourself. It's just so easy to be keto.
But is it simple?
It's super simple. We hope you enjoy making it as much as we are enjoying eating it.